Welcome, everyone. Thank you for joining us this afternoon. My name is Michael Vu. I am the Assistant Chief Administrative Officer for the county. Let me start by doing a couple of housekeeping items. The workshop today is best viewed from Chrome and also works with Safari, Firefox, as well as Microsoft Edge internet browsers. The meeting is being recorded to ensure we capture all of your input and ideas. This includes the chat function, as you will soon learn. Tonight, we are using Zoom webinar. This means that you will be able to see the presenters only and will provide feedback to us in the chat, as well as the polling feature that we will go through tonight. All attendees have been placed on mute. The chat icon is located on the bottom of your screen. Your comments will be viewable only to the panelists and not by other attendees. Throughout the workshop, we will be posting information and links in the chat. Let me repeat that. Throughout the workshop, we will be posting information and links into the chat for you to engage with us. This includes links to the polls that we will use to gather your feedback, in addition to comments that you provide in the chat itself. After introductions, we'll have a test poll where we can try this feature out together. Now, I'll be joined by several other members of the county team who will be helping me facilitate the conversation tonight, including our newly minted Director of Office of Equity and Racial Justice, Andrew Strong, Claudia Silva, who just spoke, Director of Ethics and Compliance, and Elizabeth Bustos, Community Development Liaison. You may also hear color commentary from Andy Pease, the Acting Chief Operating Officer of our Health and Human Services Agency, as well as Ebony Shelton, the Deputy Chief Administrative Officer and CFO. Before I proceed any further, I would like to turn the time over to the Supervisor for District 1 and Vice Chair of the Board of Supervisors, Nora Vargas, to give some opening remarks. Supervisor?
Hello, thank you so much. Michael, you can hear me, right? What is it? The same question that everybody asks everywhere on Zoom, even though we've been doing this for a year. But hello, everyone, and welcome to the COVID-19 Funding Community Workshop. I am really excited. Thank you to all the staff that is joining us today from the county team. But I really wanted just to say that in the spirit of transparency, I really called this workshop because for me, it's really critical to have our communities be part of the solution and how we prioritize the anticipated stimulus funds from the federal government. And one of the many priorities is to make sure that we have an equitable economic recovery. And with that, what we want to make sure we're able to provide assistance to individuals to help them get back on their feet. So now more than ever, it's very important for me that we seek community input to ensure government is really truly working for our communities and for people. I've been working tirelessly with the county team to ensure we get as many people vaccinated in a quick, efficient, and equitable manner. And, that's the first part, but I'm also very committed to doing the same as we look ahead to a path towards economic recovery, right? There's an estimated 250,000 San Diegans that are now unemployed. In a report released by the San Diego Workforce Partnership, we see that San Diego's January seasonal adjusted jobless rate held at 8%, and 3/4 of the affected businesses were women or veteran-owned. Families that were already struggling to make ends meet are being hit the hardest, and it is our responsibility to make sure that we level the playing field in our communities and provide resources that help stimulate economic recovery in an equitable manner. So overcoming the pandemic does not only depend on equitable and plentiful vaccination efforts, but also it includes economic support for those that have struggled the most. I think all of you know that we've recognized the impact that COVID has had on our business community. The County of San Diego, we voted to set aside $30 million in COVID-19 relief for small businesses, and there's an addition to the $47.5 million awarded to small businesses previously. And in the state of the state, the governor also announced additional funding, right, including the $2.6 billion in the Small Business Grant Fund. And so I want to make sure that we do this, that we leverage every connection that I have across the state and across the country to ensure, and that we all have to ensure that we are on a path to recovery and additional resources to our community. So I'm excited that all of you are here. I want to work with all of you as we try to address this, because I want to make sure that your voices are part of this discussion. And I am very, very much looking forward to hearing from all of you. And this will be only the beginning, right? We will have the other actual budget meetings when the budget process starts. But I think this is the first step of the kind of work that we're going to be doing moving forward. And again, I want to thank all the county staff that helped prepare this, and all of you for working so hard to keep our community safe as well. So thank you, and I can't wait to hear from you.
Thank you, Vice Chair Vargas. We are so excited to have everyone here this afternoon, and we're going to go ahead and get started with a practice poll to show everybody how this feature works. We'll be doing polls throughout this workshop to gather your feedback. When you see this slide, this is audience poll, it means we're getting ready to ask for this feedback. So now we're going to walk you through how this will work. We're providing you a screenshot of what it will look like as you log in. Please use the link in the chat box to access the poll, or enter the web address that is noted at the top of the slide into your web browser. This link is going to open up a separate window on your computer or phone. Don't worry, the Zoom link and the Zoom webinar will stay connected. The first time you click on the link, it will ask for your name. You only need to enter it once, then click Join to be taken to the poll. Poll questions will be provided in all 6 languages. I'm going to pause for a moment while you click on the link in the chat and provide your name to enter the poll. Please go over and click into the chat box and onto the link. Enter your name. You can enter the poll. In the chat box, it says test poll and an HTTPS. That is what you should be clicking on to link to the poll. You should now be seeing our practice poll, ranking your favorite ice cream. There are 3 choices: pistachio, vanilla, and chocolate. You're going to rank each one of these from your favorite on top and your least favorite on the bottom, but it's ice cream. Are there any really no favorites? So to move the flavor in the order you would like, click on the box that you would like to move. Up and down arrows will appear in the left side of the box. Click on them, up or down, to change the order of the flavors. My favorite is chocolate, so I would click that box. Then I would press the up button twice to put it at the very top of the list. Once the choices appear in the order you would like, click the blue Submit button. Take a moment now to rank your choices. When you're done ranking your choices, click on the Zoom icon and you'll return to the webinar. Great, we're starting to see answers coming in right now. Oh, chocolate and vanilla are like going back and forth. It's a tight race. Chocolate's in the lead. Vanilla, oh, it's right on its tail. Oh, chocolate took a fall back, and the results are in. Nope, neck and neck. Chocolate is in first place. Vanilla is in second. They're neck and neck. Looks like chocolate and vanilla are in first place. I'll now hand it back over to Michael to get started with our overview of the workshop today.
Thanks so much, Claudia. As you can see, the reason why we did this test poll is to give everyone a chance to see how this will function throughout the entire night, and it looks like many of you got it on the first try. We'll be using this ranking function more in a few minutes, along with some other polls. We'll give you just a few more moments to rank your choice, and don't forget to click the blue Submit Response button at the bottom of the screen to have your choices recorded. Thank you so much for participating in our practice poll. These polls, along with the chat feature, are a key way that we'll be getting your feedback today. So before we begin, let me just talk a little bit about this practice poll, and let's get started with our overview for today and what the purpose of today is all about, as Supervisor and Vice Chair Nora Vargas has mentioned already regarding your participation, your engagement, in how we should be distributing funds that will be coming as a result of the American Rescue act that President Biden had just passed, which was approximately $1.9 trillion. Of that $1.9 trillion, for the very first time, a large sum, $350 billion of that is dedicated to state, counties, cities, territories, as well as tribes. And as I mentioned, of that number, $130.2 billion is going to be dedicated for counties as well as cities, as you can see here on the screen. A total of 65, almost split right down the middle, $65.1 billion for cities, as well as $65.1 billion for counties. This is the first time that all cities, including those within the region, our region, all 18 cities will be receiving federal funds. The prior stimulus funds, only the city of San Diego had received funds, and then the county also received the funds, of which we distributed out to the remaining 17 cities. So of the over $130 billion worth of funds that was passed as a result of the American Rescue Act, San Diego County will be receiving $1.26 billion. That is the entire region. If I can get to the next slide, let me go through what that looks like for all of you in terms of what it breaks down to of that $1.26 billion. Of that number, 611, nearly 612 million will be going to all the respective cities. As I mentioned before, all of the 18 cities will be receiving some portion of that. Our allocation, the County of San Diego's allocation, is nearly $650 million. Now, one of the things that I should mention with these dollars is, unlike the prior funds that we received from the CARES Act, where we had to spend all the respective monies and allocate all those respective monies by December 31st of 2020, in this respective bill that President Biden passed, we have the ability to spend that money across not just a 9-month window, but all the way through December 31st of 2024. So we have much more time to be methodical and thoughtful about how we will be dispersing these respective funds. And so it's only that much more crucial to receive your input tonight. Let me get to the next slide when we talk about what the American Rescue Plan funds can be used for. Well, of course, certainly one of the fundamental aspects of that is for the COVID-19 public health response. Also, because we know that the pandemic has created a huge impact, a negative impact across the region when it comes down to business. There's an economic impact, which it could be used for. It could be also used for reduction in revenue. As many of you know, county government, city government receives their funds generally through taxes. And so there's always been shortfalls when it comes down to things like travel, things like tourism, things like just simple purchases that all of you make, and how that funds the various government sectors that are out there. We can also use the monies for investment in infrastructure. They really call this one out where we could use it for water, sewer, or broadband. And then finally, we have the ability to use these funds for premium pay for essential government workers that are out there. What we have the ability to do, according to the funds, is to pay for government employees up to $13 over and beyond their base pay. So those are some of the inputs that we will be asking for you today and how we should be using these respective funds. And now that I've gone over the American Rescue Plan Act, I'd like to turn the time over to Claudia.
Thank you, Michael. We're going to take another poll. For our next poll, we would like to see what our attendees' primary languages are. In addition to English, we have provided Arabic, Chinese, Filipino, Spanish, and Vietnamese interpretation. Just like last time, please click the link in the chat box to get to the poll. From there, you will select your language. And as the responses come in, we'll see the results live in the chart. We have some Spanish speakers coming in. Great. Great, we're starting to see some more answers coming in. We appreciate everybody's participation in the poll. If you're having trouble with the poll, please let us know in the chat. It is best to use Chrome. The poll does not seem to work in an Explorer browser, so go ahead and use another browser like Chrome. And Safari works too. Thank you, everybody, for your participation. Looks like we are at about 75% English and 25% Spanish. Thank you all for your participation. I'm going to now hand it back over to Michael.
Thanks, Claudia. Let me go to what previous and prior funds that we received from the federal government has been used for during the first stimulus funds called the CARES Act monies. As you can see here is that funds have been used for items such as vaccinations. As you can imagine, these are fundamental aspects to keeping everyone healthy and safe. So not just the vaccinations, but also to test, trace, and treat respective individuals that may have symptoms or are COVID-19 positive. Also, it's regards to our county response. This includes an array of different services and county efforts to respond to the pandemic. It includes costs for PPE, public safety, telework, infrastructure, outreach, sanitation, compliance efforts, other support services, and administrations. Also, what you see there is the COVID-19 emergency income stipend. This is a $1,000 one-time stipend to provide individuals who are employed, are positive for COVID-19, and have no sick time or benefits income while they isolate. And then finally, we also have the Great Plates Delivered. Now, you may be wondering, what is Great Plates Delivered? Well, that's a program where home-delivered meals to at-risk seniors is delivered and prepared by local restaurants. Great Plates, it's called 1.0 because there's a 2.0 version, which I'll get to here in a second, provides 3 meals daily to those 65 and older needing to stay home, and the current enrollment as of today is approximately 5,000 individuals have participated in this as in terms of a service that we've been able to deliver. Now, these 5 different categories continue today. As I mentioned before, the stimulus funds during the first round, called the CARES Act, ended December 31st of 2020. However, as you can imagine, these are fundamental aspects to keep the robustness of our community as well as the safety of our community. And so the County Board of Supervisors decided in early January to continue these respective programs. I should mention that these programs have been coming at the county's use of the county's funds to the tune of approximately $12 million per week. Let me repeat that. It's $12 million per week that we have been continuing our efforts to keep everyone safe and healthy, as well as providing service to our most vulnerable. Those dollars, as you can imagine, needs to be recouped in terms of, since we are using county funds. And so that's going to be part of the discussion that we have and part of the recouping of those monies that we will receive. One of the things that I did not mention in terms of the use of the respective funds is that we will be receiving, as I mentioned, $650 million. However, we will not receive all those funds in one lump sum. We will be receiving those across 2 time frames, which I will get into in further detail. But I believe we have a couple of other slides where we've used the other CARES Act monies for, including food banks, both to the Jacobs, Cushman, San Diego Food Bank, as well as to Feeding San Diego. We've used it for business stimulus, small business stimulus programs, grants, where we've awarded 7,000 awards to the tune of approximately $9.5 million per district. We also have provided rental assistance. This program will provide a grant of approximately $1,500 per month for a maximum of 2 months. And that was used during the prior rounding of funds. Many of you may know or may not know that we actually have currently another rounding of those funds which is to the tune of $107 million that individuals can apply for currently right now during its opening period. Also, we have child care provider grant programs. In this past use of the CARES Act, we provided monies to the San Diego Foundation, YMCA of San Diego, as well as the Child Development Associates. We provide child care for essential workers. These are vouchers issued to child care providers on behalf of COVID-affected families through the San Diego Foundation, as well as the City of San Diego providing a contributing matching of $5 million. We, as I mentioned, provided Great Plates Delivered 2.0, which is similar to the 1.0 version. However, it's for just 1 meal per day, and the total number of funds used for that was through the CARES Act. Also, we provided another service for the youth, our youth, child welfare services, as well as city expenses to the, as I mentioned before, the 17 cities where the City of San Diego received their own lump sum funds of the CARES Act. Finally, we provided remote learning access, where we contributed $2 million of the CARES Act funds for learning internet access for students through the San Diego Foundation, as well as the San Diego County Office of Education. And then finally, we provided behavioral health services, which was an array of one-time investments to our behavioral health service providers for infrastructure enhancements, telehealth efforts, investments including facility improvements, training, IT, data registry, transportation, outreach, and again, emergency rental assistance. We can get to the next slide. So let me go ahead and turn this over to Elizabeth Bustos, who is, as I mentioned, our community liaison for the county.
Thank you, Michael. And it's wonderful to be here with all of you for such an important conversation. Now, for our third poll, we're going to be doing a word cloud with you. This is the time we're very interested to learn what areas of San Diego you are representing. So who is in this virtual house this afternoon? But just as before, you can click the link in the chat to give us your response. We'd like you to type in your 5-digit zip code. Don't forget to click that blue button to submit your response, and that's at the bottom to make sure your voice is heard. So let's pause a few seconds to let everybody become reacquainted with this poll. Aha, the word cloud is starting to become live. We see here 91911, 92154, 92142, 91910, 105. Very, very nice. Thank you, everybody, for chiming in. Ooh, 91913 as well. Great representation. Thank you. Thank you very much for that. We'll give it about 5 more seconds or so. I think we're good. Ooh, no, lots of participation. 91942. 101 is in the house. 116. Nice. Thank you, everybody. Thank you so much for allowing us to hear your voice and letting us know who's in the house. And so with that, I'd love to turn it over to Andrew Strong for what follows next. Andrew?
Thank you, Elizabeth, and thanks for everybody's participation this afternoon. As Michael said, this is really key to making sure that the funding is prioritized in a way that really reflects the community's needs. So we're very excited to be here, and thank you very much. So this next part of this meeting is actually a very important step. So I want you to pay particular attention to what I'm about to cover. The next step is to cover 10 funding categories. Now, several of these overlap with what Michael said earlier, so I'm going to briefly discuss the priority areas. Now, as I'm covering these details, please be sure to be thinking about what are the most important to you, because in a few minutes, we're going to be ranking these similarly to the way we did our ice cream flavors earlier. So, without further ado, let's get into these 10 categories. So the first category, child care subsidies. Funds could be used to issue child care vouchers for essential workers so they can return to work and have adequate child care arrangements. The board had previously provided vouchers to over 3,600 families and for over 5,200 children. In addition, the board invested funds to over 3,300 child care providers so they could keep their child care facilities open during COVID-19. The next category is direct stimulus for individuals and for families. A direct payment could be issued to an individual or family who were directly impacted by COVID-19. The one program the board has in operations currently is COVID-19 Positive Income Stipend Program. But other areas could include helping families cover funeral costs for those who died due to COVID-19. The next category, food assistance. Funds will be used to address food needs of individuals and the community. Historically, we focused on programs such as the local food banks, as well as the Great Plates Delivery Program. The next category, homeless shelter services. Funds could be used to address the health and safety needs of the homeless impacted due to COVID-19. Our next category, infrastructure. The American Rescue Plan allows for funds to be used to invest in sewer, water, and broadband infrastructure investments to ensure these critical services are maintained to meet the health and safety needs of the community. Our next category, mental health services. These funds could be used to ensure services are available in the community for those who are dealing with a mental health or substance abuse use disorder due to COVID-19. Currently, the board has invested in mental health, substance use disorder programs, including ensuring adequate telehealth infrastructure is in place to meet community needs. Our next category is premium pay for government essential workers. The American Rescue Plan includes authority to pay a premium to local government workers who are providing critical, essential governmental services necessary to address the needs of the community, such as direct COVID response, public health staff, child welfare services, adult protective services, as a few examples. Our next category is rental assistance or tenant and landlord services. Now, these funds could be used to provide rental assistance to those financially impacted by COVID-19. To date, the board allocated $27 million towards rental assistance, up to $3,000 per applicant, and served approximately 9,000 to 10,000 recipients. Currently, the county has a new rental assistance utility program that's currently open. It's totaling $107 million. In addition, funds could be used to assist tenants and landlords dealing with legal issues tied to evictions and other matters. Our next category, senior or youth services. Funds could be used to specifically address the needs of seniors and youth that have been adversely impacted by COVID-19. Areas to consider are relief for caretakers who are caring more for seniors who cannot safely leave their home, otherwise known as respite care, investments to students and seniors such as laptops and Wi-Fi to allow for remote internet access, use of funds for transportation vouchers. Our next category, small business stimulus for private, for-profit, nonprofit. Funds could be used as grants direct to impacted small businesses, restaurants, nonprofits, funds to cover payroll, investments to keep the business operational, or to adhere to public health orders. So those are those big bucket categories that we're going to be ranking in a few minutes. Next, I'd like to turn it back over to Michael Vu to recap a couple of things he discussed earlier.
Thanks so much, Andrew. Just to really quickly, as I had mentioned before, is that the county is going to be receiving approximately $650 million. At least that was what we're estimating as a result of the American Rescue Plan. There are some things that should be mentioned about these funds, however. As I mentioned, there's going to be 2 time frames for us to receive these respective dollars of the 650. It's not going to come all at one time. It's going to come 50% of that money is going to come 60 days after the bill was signed, and the other 50% of those funds is going to come 12 months after the first payment. So again, we won't see half of these dollars until a year later. And so we want to make sure that you're cognizant that not all $650 million is going to come in all at one respective time. And so one of the things that we want to reinforce is that there are fundamental things that are currently going on that we need to make sure that we're paying for. First is vaccination, as I mentioned before. These are fundamental aspects of us getting through this pandemic. Second is the testing, the tracing, and the treating efforts that is ongoing, as well as the general COVID-19 activities like the purchasing and public safety and enforcement that I had discussed earlier. Also is the Great Plates program that we have out there as well. With that, now that we've kind of given you overall background associated with this, what we'd like to do is to start getting into the polling of these respective 10 categories.
Michael, I don't know if you can see me. Can you see me?
I can, Supervisor. Go ahead. I see that your hand is up. Go ahead.
Can I just ask you a question? On the food assistance program, and this is just a clarification, just to make sure that other folks know, is that going to be sort of the funding for the pandemic EBT? Would that be included in that, or is that something separate? Right? Because I heard a lot of my constituents tell me that the $365 per child really made a difference, and the fact that people received the card. So I was wondering if that's part of this program, or is that in a different bucket?
So, Vice Chair Vargas, this is Andy Pease. That would be a separate bucket directly from the federal government. That EBT component is for students in schools to get food. But that would be a separate bucket. That would be outside of these dollars.
Okay, and we can fight for them somewhere else, or do we make, or could we make some of these allocations something like that? I know this is not my meeting for the community to ask questions, but I just want to make sure I know, because I feel especially for District 1, that was particularly a huge issue.
So for specific for the EBT program, that is a very specific federal program, and it flows through a very particular route. So we would not be able to directly impact that program. If there was an interest, I suppose it could always be explored if they wanted to augment those type of services at the schools, and then we would perhaps have to work with the County Office of Ed and look into that.
All right, I'll follow up on that one. And then one of the panelists is asking how much of the first $300 million is already allocated then, and how much is going to be able to be allocated with buckets. Do we know that? Because I know that you said that, obviously there's money that has to stay in the GTT, right? The testing, and that one, the program, the COVID, Great Place to Work, and you said the vaccination. So how much money are we going to be able to use that is not already, or do we know that yet?
We don't know that answer to that question. I think that's probably the $10,000 question on the table, or maybe the $350 million question that's on the table, because again, we are still in the middle of the pandemic itself. So we don't know how long we will need to continue expending perhaps $12 million per week until we can really get through everyone vaccinated. And so that's going to be key. And of course, part of that key is making sure that we get vaccine into the region. Supervisor, you mentioned a really good topic. Although there may be a separate funding bucket in terms of the EBT, we want to know what the community's priorities are, even though there may be other buckets that are out there. So although Andrew has spoken about the 10 categories here, we just don't want to stop there. These are 10 funding categories, main funding categories that we've come up with. Part of the purpose of this workshop is to see whether or not there are other priorities that we may be blind to or may not be thinking about that we want to really tease out to the respective community, to all of you that have so kindly taken your time out of your day to participate in this discussion. So there will be another piece to this. So if they're not located on this slide that you can see here, absolutely, we want you to go into the chat feature now and type in other funding categories that we may need to consider, or the board needs to consider, when we really compile all this information and report back to the board as a whole. So go ahead and do that now if you'd like.
Thank you, Michael.
Sorry, Ray, get into the poll.
And as you're putting together the funding, as people are answering, I'll just answer to the question about is there funding to bring vaccination units to large businesses with over 80 employees? Is there funding for that service? So we are actually working on that. I know it was the Otay Chamber, who I love. Just so you know, we are working on based on conversations that we've had, Alejandra, to make sure that I think it's Alejandra. So we're looking at other options as soon as we get more vaccines, so we're able to get out there, and we'll circle back. My team will circle back with you on that one, because we are working with IHHS on that. And Barbara, I think I saw Barbara on here as well.
I know that there's a question about the 80. Know that the board head supervisors have also allocated, based off of the federal funding that we would be receiving, $30 million to small businesses up to 20 employees that are out there. So please take note of that as well. But again, part of this exercise that we're doing today, part of the workshop that we're doing today, is really getting input. That way we can share with the Board of Supervisors. Does it need to be more or less? We want to know and really tease that out of the participants tonight in every single one of these respective categories. So with that, and again, if there are other main categories that are out there, please put that into the chat feature. I'm going to turn it back over to Andrew to begin the polling of every single one of these 10 funding categories.
All right, now for the main event. So just like before, we're going to do another poll. We're going to put the poll in the chat, a link in the chat. So once you see that link, go ahead and click on it, and I'll pause for a couple of seconds, 3 seconds, so everybody can access the poll.
Andrew, I don't mean to interrupt you, but there's somebody asking that if they don't speak English, they don't understand. So I just want to remind people that there's a little globe on the bottom for interpretation. So anyone who is on this webinar can go ahead and click at the bottom where it says interpretation, and the information should be in Spanish for you as well. I don't know if the poll is in Spanish, but if it isn't, it is.
Absolutely.
There you go. So the poll is also in Spanish, so people can get that as well. I think there was one of the folks who was putting on the chat.
Okay, thank you, Supervisor. All right, so next we're going to rank your priorities from highest to lowest, just like you did before. We already see some answers rolling in, but let me go ahead and read these instructions just in case. Once you're in the poll, you'll see the 10 categories in 6 languages. You can move them up and down by clicking on the box you'd like to move, and by clicking up or down, that appears on your left. Once you rank the categories, your highest priority on top, click the blue Submit Response button at the bottom of the screen. Keep in mind that you will need to scroll down in your browser or on your phone to see all the categories. All right, I'll pause again to allow for some time to rank that, because I know it takes a little bit of thought on some of these. But remember, your highest priority is on top. And we're starting to see some come in. Good. It's like the small stimulus payments are running away with it so far.
Okay.
All right, thanks everybody for your feedback. I see some answers are still coming in slowly, but it looks like we're almost there. So just remember your answers along with those from the other Board of Supervisors. Oh my God. Along with the other Board of Supervisors events that they'll be having, we'll be taking those into consideration, and it will inform how this money is spent. So it's very important for us to get your feedback. So as we're waiting for everyone's rankings to be submitted, I'll talk to you a little bit about how the next polls will go. Based on your responses, the 10 rankings, we'll take the 10 categories in the order you've prioritized and ask some follow-up questions. Depending on the category, we may have you rank some additional subcategories or provide some additional information in the chat. While we're giving everyone a little more time to rank those categories, feel free to use the chat. And again, just to reinforce, if there's any additional categories that you don't see on there that you want to add, and let us know, please post them in the chat. There you go, Carol, I like that. Didn't care about the ice cream, but I care about this. That's good.
Nice.
I'm not an ice cream fan either. I'm lactose intolerant. Probably too much information.
Andrew, I feel like so much closer to you now. I have the same problem. I'm just kidding.
Do you? I'll tell you. Chocolate chip cookies, though, that's my favorite. I can get down with some cookies. So it looks like employment. We'll assist with employment as an option. Good. Somebody can hear the Spanish. I think you saw that. That's good. How can we get people back to work? All right, we have 15 seconds until our poll will end. Get your answers in quick. All right, how are we collecting information from people who don't have access to this Zoom space? That's a great question. Is there another mechanism they can use? And I think they can absolutely send us feedback to the Board of Supervisors office, but also engage with our staff here. We'll put some contact information out there for you.
So yes, and so that everyone knows, my district is going to be using communication tools to get out there and really ask folks about this. We've done it in the past. One of the things that I'll do is we'll email it out, and I was actually just texting my staff and asking if it was possible for me to actually send this poll out so I can get rankings from community members as well, because we can do some other things. But thank you for that question, because community input is absolutely important, and sometimes what happens is a lot of the organizations have the ability to engage, but other folks don't. So we will make sure that we try. If anybody has ideas, put them on the chat. I'm writing down notes that, that anybody who's putting stuff on the chat, just let me know, and I'll make sure that I'll take down the notes, and we'll follow up as well.
Thank you, Supervisor. All right, I think our chat or our poll has ended, and next I will turn it over to Elizabeth Bustos, who's going to talk a little bit about a couple additional feedback opportunities.
Thank you very much, Andrew, and you are engaged. So thank you very much for letting us know you're thinking about all of this, and then this is the time where we get to do deeper dives on your good thinking. So it looks like the top 10 priorities are rental assistance, you've got food assistance, child care subsidies, direct stimulus, small business stimulus, senior and youth services, mental health, homeless services, and pay for government essential employees. So thank you for that. Okay, so you'll notice I really did want to bring attention to that other category, because that other category is very important, because this is the opportunity where you let us know if we've missed anything that is not called out, but you really want represented in this conversation, and hopefully and inform future conversations, you let us know. So now is the time. This is what the chat is for, where we hold this space together. Okay, so about 30 seconds more or so coming up. How's everybody doing? Hanging in there with us?
Yeah, health services is another category.
Nice.
And which bucket gives on access to undocumented folks? Good question.
Yeah, so,
I just, before you continue, I just want to share that I just went to the interpretation and I listened to it in Spanish, and it's working, because I know people keep asking. So I just want to make sure everybody knows that it is working. So thank you for the translators.
so one of the questions that came up is which bucket or which component supports or covers for undocumented folks. And so far for the programs that the county has rolled out, like the COVID income stipend program, rental assistance, it does not take into consideration one's status. So those citizenship or anything like that is not one of the questions that's asked. So if those services are available and you qualify, then you are eligible for that.
Thanks, Andy.
Yes, thank you for that, Andy. And I also see a comment or question, prioritizing, thank you, and prioritizing programs, specifically prioritizing use of color. Is that embedded in there, Andy?
I know we have a recent board policy that deals with, looking through an equity lens and whatnot. So that is certainly a factor that this board is taking into consideration when allocating and standing up programs and services to make sure that those services are getting into the areas that are most impacted.
And so I do want to share an item connected to that I will be introducing, so that you know, a board letter related specifically to equity and budgeting. And as we're drafting it now, I will be using that as a tool in my recommendations to, when we review all of this information that all of you are prioritizing for us. And so please know that the equity lens will be how we will be looking at how we allocate this work, and I will make sure that I encourage my colleagues on the board as well.
Screens, we're doing the rental assistance polling, and this is where we ask you to rank the program from highest to lowest priority. And you see there.
So the categories for when you're looking at rental assistance, and what's the best way we might be able to utilize these funds? Is it for direct rental support, either to the landlord or the tenant, to ensure that those rental costs or the lease payments are being covered? Or what about utilities? Is it more important to ensure that those costs are covered? How important is legal services for tenants or landlords who are challenged with all the legal issues going on during this period of time? Maybe a tenant is being evicted improperly, and they need that sort of legal service. Or maybe there's something other there. So it's your chance to go into the poll and categorize which one of those do you think is top priority. highest priority to lowest priority. And if you have other, maybe there's something else, then that's where we'd ask you put it in the chat room and state specifically what that might be.
And thank you for that, Andy, because what we see here is the rental assistance.
Right. Now, yes, and there is a question about which bucket will assist homeless with hotel rentals, and that I believe is under our category called homeless. That's where we were thinking that those type of services would be part of that program. But if that is important, make sure that gets communicated.
And thank you. If I may, one more, Andy, through the chat. Mortgage support is also needed. Which one of these buckets?
So I would put that under the rental assistance as an other category, because the focus has been on rent. It hasn't been on mortgage relief specifically. I do believe there might be some of those dollars in the American Rescue Plan outside of the $650 million that Michael has been talking about. But we would like to hear from you if that's an area of interest.
Thank you. Thank you for that, Andy. And we're just getting ready to transition into our next category.
All right, our next category is food assistance. And here's the breakdown of that. So remember, food funds could be used to address food needs of individuals in the community. Historically, we've focused on programs such as the local food banks, as well as the Great Plates Delivered program. So a little bit more about food banks. The county has provided funding to the Jacobs Cushman San Diego Food Bank for them to provide foods to individuals and families who face food insecurity, poverty, and financial challenges tied to COVID-19. Great Plates Delivered program. This program provides 3 home delivered meals a day to at-risk seniors as age 65 and older by using local restaurants, so it gives back to our local restaurants. Currently, approximately 5,000 enrolled between 40 and 50 restaurants, serving almost 100,000 meals a week. So feel free to go ahead and rank the subcategories here under Great Plates, Food Bank, or Other.
Let me just reinforce again, there is a link in the chat for this, so go ahead and go to it. It's called Food Assistance, and then there's a link that you can select to start ranking those 3 subcategories.
And then there's something in the chat, that access and equity piece as far as how it's distributed is so key. I absolutely agree with you on that one. Looking through the equity lens to make sure we distribute that in an equitable manner. It'd be great to look at where past stimulus fell short. Absolutely. One of the main reasons why we're doing this.
Yes, and I think one of the big challenges that we had last time around, and I know I was very vocal about this during the prior to becoming a supervisor, was the issue that a lot of this work was, a lot of the way we divided it up was based on population and not necessarily on need. And so I think the reason why the board is so committed to looking at things from an equity lens is because as the safety net, we really need to start looking at this. So your participation is critical to this because as we hear from you directly, it allows us to really look at how we are ensuring that our community's needs are met. So I really appreciate those comments.
Absolutely. All right, looks like we're ready to transition to the next poll. I'll turn it back over to Elizabeth.
Thank you very much, Andrew. Okay, so we will be transitioning to child care subsidies. And child care subsidies, and let me take off face covering because I can in a safety zone that we're on right now. Funds could be used to issue child care vouchers for essential workers so that they can return to work and have adequate child care arrangements. The board had previously provided vouchers to over 3,600 families and for over 5,200 children. In addition, the board invested funds to over 3,300 child care programs so they could keep their child care facilities open. So very, very important here.
Luis, and thank you for that issue that addressing the food assistance as other. I also clicked on other. The idea of having these food pantries We had one at Southwestern College that was very successful, each of the centers, and so I've actually been talking to county staff about how could we do this, and so I really appreciate that you put that on there, because I do think, I'm also thinking refrigerators, but we'll talk more about that as we're looking at also not only this budget, but I think this budget will also help us. I mean, how we allocate these resources will be one phase, but then also looking at the actual county budget later on in March. What is it, April, March? At the end of March, we'll start looking at it again and looking at that as well.
So, okay, did the childcare subsidy pool go out because it looked like it was linked with food
To food.
in the chat?
It's going to be only in the chat, so there's no subcategory for childcare subsidies. So if they have anything
Oh, I
to
see.
add, they're going to put that in the chat.
Okay, I see.
Okay. Give it a few more
Yeah.
seconds.
You want to correct.
Yeah.
Okay, so just as a point of clarification, for the child care subsidies, there were no subcategories that were provided. So this is your opportunity for you to provide your best thinking on this and what your vision for best utilization of child care subsidy funds would be used. And see a comment here, child care providers should also be prioritized, a prioritized group to get the vaccine.
They already are. So
They
child
already
care providers. So I just want to make sure if you're a child care provider, you're part of the last phase. The new phase right now is 16 to 64 with healthcare conditions and disabilities. But if you're a child care provider, you are already on that list. I know some people have had challenges because formal and informal, by the way. So if you are an informal child care provider, by that I mean you don't work for an actual entity. You need just a letter from the person or the family that you know that is contracting you to do this work. We understand that many of them have had challenges of actually accessing the vaccine because there are not enough vaccines, and that's a whole other issue that we're really working on. But we know that there's more vaccines coming, and according to the President Biden, everybody will be vaccinated by the summer, so we're very hopeful for that. But if you're a childcare provider, you are already on the list, and you should be able to get one. If for some reason you can't, feel free to call my office, and we will try to help you with that process if you're having a problem or somebody says that you can't get it. But I'm pretty sure that you shouldn't have a problem in any of our county entities. As long as there's a vaccine, you can make an appointment.
And thank you very much for that, Vice Chair. Some very thoughtful comments and observations are coming through the chat. And if I may, I'm just going to call out a couple. Subsidized for low-income essential workers and for providing that they are serving low-income families. Yes, yes, yes. And then there was, how about tutoring? Tutoring before and after school support, K through 12, educational support for those that have fallen behind, very important. This is childcare for county workers who have to work in person while children are still remote learning. Very thoughtful and woven into your chats. It does not escape us that these are your real life experiences. So thank you very much for that. And okay, this is the time where I get to transition back to my colleague and our friend Andrew Strong, please.
Thank you, my friend. All right, so the next category is direct stimulus, and we have a couple of subcategories, so we'll do another poll. Remember, the link is in the chat for the poll. So the direct stimulus, this could be in a couple of different ways. We have direct payments that could be made directly to families and individuals who are impacted by COVID-19. Of course, we need to establish some guidelines and parameters for that program. Or we could also do funeral assist, and this is to cover costs of funeral services of those who died due to COVID-19. Now, currently, the county does have that COVID-19 positive income stipend program, that's currently in place, and that program provides $1,000 in one-time stipend to individuals who are employed, are positive for COVID-19, and have no sick time or benefits income while they isolate. Now, as of 3/11/21, approximately 17,000 individuals have qualified for a stipend. So if there's additional subcategories you'd like to add, also you can type those in chat as other. So again, we're ranking the direct stimulus payments. You can click the link in the chat to access the poll and rank them accordingly.
And I think we'd be really interested in knowing if, because the direct payments is the number one ranked one so far, do you have any suggestions on what the conditions are to receive it? You know, with 3 million San Diegans, it wouldn't take very long for those dollars to be completely go if, you know, we just opened up to everyone. So we'd want to narrow it down. What would be those parameters? If you have thoughts on how to allocate those dollars, that would be helpful.
All right, I think we're ready to transition to our next poll. Back to Elizabeth.
Thank you, Andrew. And that our next category will be the small business stimulus. And a description of that is small business stimulus, private, for-profit, and nonprofit. Funds would be used as grants directed to impact small businesses, restaurants, nonprofits, funds to cover payroll, investments to keep the business operational, to adhere to public health orders. So this is another one. Oh, and of course, and other category as well. So no worries that there's no subcategories here, because this is kind of like freestyling. Let us know your ideas, your best thinking on what small business stimulus would look like or should look like. What's coming in?
This could be also in the terms of the overall amount. As I mentioned before, is the board has already voted upon this. Should federal stimulus funds come down to us, that $30 million would be earmarked for small business stipends and grants that would be out there. So is $30 million enough? Is it too much? We'd love to get your feedback associated with that.
So thank you, everybody, for your best thinking on this so far. Stimulus to unemployed people, I think. And I see something for our interpreters. Did the Spanish interpretation stop? I just wanted to acknowledge that there's a concern that came in about that. And we're checking on that. Thank you for that. Consider quick access grants between $15,000 to $30,000. We've got to talk to business owners asking for that range of funds. A comment here. I haven't received the small stimulus poll yet. Oh, so that's okay. There is no.
Yeah, there's no poll.
There is no poll. You're good, Ms. Cardona. There were no subcategories attached to this stimulus ask. So just let us know if you've got some thinking. Put it in the chat box, and we will capture it. Nonprofits. Just got a shout out to nonprofits. Let's see, direct payments to businesses directly impacted by COVID. Don't duplicate employee pay, which is addressed via other legislation. Help to subsidize costs directly associated with extraordinary costs required to remain open during the crises. Yes. Another comment coming in, suggestion, this is all small business related. Support of businesses that are locked into a lease and need subsidies to pay the rent. Subsidy for hazard pay for businesses with employees, and funding for safety, sanitation, small grants for expanding online capacity. And at this point, sending it back to you, Andrew, for
Thanks,
the next
Elizabeth.
category.
So our next category is senior and youth services, and we will be ranking this one. This one has 3 subcategories. So again, get ready to click on the link in the chat, but also be ready to post if you have other. I did see earlier that there was a comment about youth services and senior services being separate. So if you have those ideas, feel free to put them in the chat. This is our senior and youth services. Rank the programs from highest to lowest priority. And here are the 3 subcategories. Relief for caretakers who are caring more for seniors who cannot safely leave the home, also known as respite care. Remote internet access, investments to students and seniors such as laptops and Wi-Fi to allow for remote internet access. And then the last subcategory, transportation. You can purchase transportation vouchers for youth or seniors to ensure they have access to health care and other essential needs. All right, see some things coming in the chat. System control. So funds are not prematurely allocated to businesses that don't deserve them. I think that's probably from the previous conversation, but still great feedback. All right, looks like respite care. Well, it was first, but now it's second. Remote learning, internet access, equitable access, right? Absolutely. Okay.
Looks like individuals are still hopping on. If you haven't seen the link yet for the senior and youth services, again, it's in the chat. Please click on that link and make your respective selections by clicking on that blue bar, the ones, and ranking them accordingly. As you will see, once you click on any of the respective blue bars, you can move the bar up or down depending on your ranking.
Specific support for unsheltered youth, and culturally competent mental and behavioral health support. That's a great comment. Absolutely, unsheltered youth. One of our highest populations of homeless are youth. We just posted the link again in the chat. I need to make it accessible to providers that are not tied to school funding. Other can be used to help pay for arts and connections for youth outside of school. It's a great comment. All right, I think it's time to transition to our next poll. I will toss it back over to Elizabeth.
Thank you, Andrew. And our next poll is all related to mental health services. And these funds could be used to ensure services are available in the community for those who are dealing with a mental health or substance use disorder issue due to COVID-19. Currently, the board has invested in mental health substance use disorder programming. And what that includes is ensuring adequate telehealth infrastructure ensuring that adequate telehealth infrastructure is in place to meet community needs. And subcategories under that would be school-based programs, suicide prevention, substance use disorders treatment. So you see your poll in front of you, mental health services. Rank the programs from highest to lowest priority. And you are active. And it's early, but, I was just going to say school-based programs, but now it's suicide prevention is the priority. And I also want to remind you that you can always think other And anything that's not listed in these subcategories, please let us know your thinking on that. And all of that will be taken into account. So thank you for that. Understandably so, suicide prevention continues to top the list, followed by school-based programs coming in second, substance use disorders third, as you can see there, and then under other, let us know what other means to you. And Efrain, other means to you, other means reaching out to residents in rural areas and tribal lands. Absolutely. Thank you for that. Give it maybe 30 more seconds or so, and you see that suicide prevention remains as first. And, you know, school-based programs and substance use disorder treatment, you see that at second and third. And then also from the chat comments, thank you. Community support groups for those who have experienced and survived COVID, absolutely. And then crisis response for mental health issues that is not accompanied by police. And thank you for that, your comment there. And with that, I'd like to transition it back to Andrew to walk us through homeless shelter services.
All right, so for this one, thank you, Elizabeth. We don't have a poll. There aren't any subcategories, but in general, funds can be used to address the health and safety needs of the homeless population. And my assumption, and Andy, feel free to chime in, is if for the, we do have homeless services. I apologize. I just don't have them on my list. But I can read them from the slide. Let's see, so housing intervention, shelter, wraparound services, or other.
So let me go ahead and explain some of these items that Andrew just mentioned. So on the housing intervention, these are funds that could be used to lease and or purchase hotels or other housing investments to ensure homeless individuals have adequate housing arrangements. You also have shelter that's in there, which are funds that could be used for more traditional congregate homeless shelters, that is, adding more people into a specific area. Wraparound services, funds that could be used to provide supportive services to homeless individuals, such as case management, housing navigation, healthcare navigations, and the like. And then, as Andrew mentioned, we've got other too, just because if you have other thoughts around this area about homelessness and the homeless crisis that we have out there and treating those respective individuals and providing them services, please, that if they're not one of these three, housing intervention, wraparound services, or shelter, please add your comments and thoughts into the chat. Thank you so much.
All right, increase health services in general. Pre-apprenticeship programs will be good for this bucket. It's a great suggestion. Wanted to thank you for that.
Thank you for the comment regarding mental health teams in the field to support those needing the support. That's going to be part of the wraparound services that we're contemplating out there too. So definitely appreciate the specifics associated with that.
All right, I think we're ready to transition to our next category. Back to Elizabeth.
Thank you, Andrew. And this next category is all about premium pay for government essential workers. And this is another category that doesn't have any subcategories. So this is where you get to let us know your best thinking on this through the chat. And so a description of this category is that the American Rescue Plan includes authority to pay a premium to local government workers who are providing critical / essential government services necessary to address the needs of the community. And this is such as direct COVID response public health staff, child welfare services, adult protective services, and these are just some examples that we are sharing with you. So again, no additional subcategories under this. Let us know what you think on the chat.
Don't be shy, one way or the other.
Let us know. A couple of good questions coming in. Why, and bear with me on this because the chat is quickly navigating. Seems not fair for a person that works at Walmart. Can you please assist me? Somebody please
Sure.
assist me finishing that thought? Because my chat is
Happy to do that.
scrolling. Yes.
Seems not fair for the person that works at Walmart encouraging COVID on the front lines. Another comment, why would you differentiate treatment between government essential and non-government employees?
Mm-hmm.
And another comment, any government employee that must interface with the community, including teachers, child care providers, must get premium pay. They are putting their lives and the lives of their families at risk. Paid self-care days.
Mm-hmm.
With so many unemployed, should this even be a category? I find it embarrassing and countering. Okay, and then someone put in countering.
Thank you, Claudia.
You're welcome.
Thank you for that.
And I think it's important. I'm going to share this because I think it's important when I think because of the way it sounds, paid self-care days, it sounds like we're paying somebody to go to a spa. That's not it. I think it's one of the many options that in many entities they use as an option instead of doing an actual stipend or what they provide people an opportunity to take a day off. And so it's something that many employers do in many businesses, and I think that's why that option is there. So I just want to make sure that it's clear for folks what we're looking at, because you have to remember, many employees are working and haven't stopped working as well. And so that's one of the many options that is available that we've seen that works, and that's why it was there. So just an FYI.
Thank you. Thank you for that, Vice Chair. And with that, I'd like to go ahead and transition back to Andrew Strong to walk us through infrastructure.
Thank you, and I think this is our last category. Woohoo, all right, we made it. So this one is infrastructure, and the American Rescue Plan allows for some infrastructure, so we'll have a poll for this one. The poll link is in the chat again, so feel free to click on that link, and we can rank water, broadband, sewer, or other. And also, if you have other that you want to put in the chat, remember that the chat is there for you to go ahead and document that. So let's see what you got. I think broadband is running away with it so far, which is very important, equitable internet access, especially in times of our online training, right, for our kids in school and making sure we have those resources out there.
As well as working, teleworking. That's
Absolutely, absolutely. Electric vehicle charging stations. Can you explain water and sewer? So you're talking about infrastructure, and I believe it's for, making sure that we have clean water and sewer, drainage and things of that nature. Andy, do you have anything else you want to chime in on that?
No, the only thing, this was one of the areas called out specifically in the American Rescue Plan. It did not provide a greater detail than that. Typically, what will happen is over the next couple of weeks, we will get greater detail, see if there are parameters to it, but I assume it's just to ensure that those critical needs are being maintained and provided, and that in any way they're not being compromised. Maybe funds are being diverted. So that would be.
So I also want to say, just as a reminder, sometimes when the federal government and our members of Congress approve some of these issues, and you have things like infrastructure, this is how we ended up getting the number of the votes that we needed, I think, in the end. And so what happens is people say, okay, I'll support this stimulus bill if we can get some additional funding for infrastructure so that different members of Congress in their particular areas can get some of those resources. And so then it ends up being something that for many of us, we're looking at infrastructure. What does that have to do with COVID at the moment? But I mean, having worked in Congress before, I think that's usually what ends up happening with some of this legislation. But it's a good thing for us because we can think about it as to what it means for our work. I wonder, would it be possible to pay for instance, transportation vouchers or something like that for our communities? I know there's a lot of discussions right now around MTS and fee increases and things of that nature. So it might be an interesting conversation to have if maybe that's one of the things that we may be able to subsidize through infrastructure.
That's correct, Supervisor. That's actually, we had put that under the senior and youth services that are out there. Certainly we can provide it for not just the senior and youth services, but for the entire population when it comes down to the impacts that COVID has made. But transportation is certainly an area that should be considered.
Thank you.
It can be considered.
I think that's it. I think it's back to Michael Vu.
Well, that was the last of the various polls that we have there. Thank you so much for all of your participation in the various main categories as well as the subcategories that we had out there. We're going to be going ahead and compile all of these results, not for just District 1, Supervisor and Vice Chair Vargas's district, but also across the other 4 districts that we have. We have one more tonight, as well as 2 on Thursday, as well as the last one on Friday. Once we are able to compile all those respective results, we will be coming back before the board to inform them of all of these respective results. I do want to thank all of you for participating tonight in what is the very first time that we have asked for input associated with the federal stimulus dollars. Again, we did not do this the last go around when we received the CARES Act funds. So your participation has been greatly appreciated. The suggestion by the Vice Chair has been greatly appreciated. And of course, we've been acting upon that. Let me just say a couple of departing remarks. I really do want to appreciate your comments, your feedback. We'll compile it and memorialize all of that, but also want to thank the team here at the county. Namely, the panelists, you had Andrew Strong, as well as Elizabeth Bustos, as well as Claudia Silva. And then you also had remarks by Andy, even though you didn't get to see his picture, but he also provided his expertise in all of these respective areas. The community at large, we could not be able to really provide this information without your input. Supervisor Vargas, thank you so much. Vice Chair Vargas, thank you so much for your participation and really urging us to get out there into the respective community and getting the input before convening and compiling all this respective information. All the staff that coordinated this event tonight in terms of the workshop, you didn't get to see them, but let me just say there's a whole host of individuals that were behind the scenes interacting, trying to put these poll sites up, categorizing all the respective categories, main categories, as well as the subcategories that are out there. A lot of steps, as well as our translation services, our interpretive services folks that were online to assist those that needed language interpretation needs that were out there. Looks like, Supervisor, you want to say a couple of words?
Yes, I just wanted to personally thank everyone on the team. First, actually thank the community for joining us. I can make recommendations for us to have community events and to do these kinds of polls, but if our communities are not participating, then it's hard to get the information that we really need. This is something that we're trying out. I really appreciate your patience and also all of your feedback. It is absolutely important. And I did want to thank the team and the staff. There's been a lot of changes at the county, and all of you have stepped up and have really taken a lot of recommendations and look at things from a very different perspective. So very much appreciate all of your work and your time and willingness to be open to new opportunities. I do want to share that this is extremely important for us as we're moving forward. Economic recovery looks different to a lot of different people. And so I just want to make sure that everyone knows that my team and I are here today. They're all listening as well. We want to make sure that we allocate the resources where we most need it. And I understand that there's other opportunities for us to reach out to folks, and we're going to be doing that as well. But I want to make sure that if you have any questions or if I can be of assistance, what I'll do is I'm going to go ahead and put, let me see if I can do this well, because sometimes I'm not getting that good at technology anymore. But anyway, there it is. You can contact me at District 1 Community at San Diego County, ca.gov, or you can call directly at 619-531-5512. Any other recommendations or ideas that you have to make sure that I am able to represent you and do the work, because this is really important. So again, thank you, everyone. Appreciate you and grateful for all of your time.
Thank you so much, Vice Chair Vargas. Let me just leave you with one last slide. Now, we may have a vaccine and we need much more vaccines coming to the region, but if there are any questions that you have related to this pandemic as well as COVID-19 and need resources associated with this, we want to leave you with this, the website, as well as a telephone number for you to reach out for any questions that you may have about the pandemic itself. With that, I will close out the evening. Thank you so much for your participation tonight. And again, we will gather and compile all this information. Thank you so much.